Hi everyone, my name is Claire. So for my population, I chose social work with children and adolescents with medical conditions. Um, so these medical conditions can range from acute to emergency to chronic. And just some examples of medical conditions. This can include, but not limited to, sickle cell disease, cancer, type 1 diabetes, and cystic fibrosis. So, how is working with children and adolescents with medical conditions different than working with other populations? So, for one, not only are you working with the client or patient, but you're most likely working with other family members, especially the caregivers or parents. Most times, the parents or caregivers are very involved in the child's treatment or medical appointments. So, as a social worker, you could be providing support to these parents or caregivers in various ways, whether it be emotional or physical. Some examples of emotional support could be providing counseling sessions for the parents individually or even for the family. And then some more physical supports include providing community resources or even financial resources. And then another way to support the family would be collaborating with providers outside of the hospital or healthcare settings, such as the school or outside providers or any other provider that is working with the family. And just kind of creating a team and collaborating in order to support the family. And then another challenge really is just managing the challenges that come with a child being in a hospital or healthcare setting. So, it's hard for adults to be dealing with a medical condition, let alone a child. These children are often missing out on a lot of socialization that other peers their age are getting. For example, they may not have the time to hang out after school because they're going to all these appointments or they're in the hospital for days or weeks at a time. They may not be able to be on sports teams or join extracurriculars, and they might not even be able to be on sports teams because of their medical condition. And then also just in general, being a child and having to have these treatments done and go to all these doctor's appointments, this can feel really intrusive and just overwhelming for a child, let alone anyone. So, challenges and needs of children and adolescents with medical conditions. So increase in stress and mental health diagnoses are some of the challenges that come with working with this population. These medical conditions can cause depression and anxiety, not only in the child, but even the parents. Financial stress is also common among families with children with medical conditions. On top of having to worry about their child's health, parents also have to worry about medical bills, medical costs. So as a social worker addressing these needs and challenges, there's a variety of ways in which a social worker can do this. This can include one-to-one work, so either working individually with the client or child or working individually with the parent or caregiver. Group work, that can be working with parents and the child, siblings, the whole family. Mediation, collaboration could also be very important. Getting other providers involved, school involved, if the child is, missing out on a lot of school, or if the child is going back to school and needs supports at school, that can be a very important institution to collaborate with. And advocacy. A lot of times, health providers may not be aware of, the other needs of the family. So as a social worker, it is important that we advocate for those needs and help the family get the supports that they need. So resources for social workers. So outside contacts could be important. So just anyone working with the family, whether it be school, outside therapist, or any outside providers. And then team collaboration, and that's a part of team collaboration too, is getting those outside providers involved, but even getting the people in the hospital or in the doctor's office involved, and so work as a team, because sometimes there is a gap between healthcare or physical healthcare and mental health care. So just as a social worker, I think it's really important to be able to bridge that gap. And then also just using mental health screening tools. So any evaluations or exams that need to be done to just see where the client or the family is at. Resources for clients and patients. So I think one important one is just access to the social worker. And this can be for a variety of reasons, and the social worker can support the family in a variety of ways. I think for one, meeting with the family and processing everything that's going on, providing the family with not only the physical resources, but even, the coping skills and tools to kind of manage everything that's going on. And then the physical stuff such as referrals and connection to resources. Also, well, as I just mentioned, outside resources, and this can include therapy, groups, and just any community resources that might be helpful for the family. So, some things that might set a social worker apart from others in this setting is just having to navigate the various systems involved. So as I mentioned before, a lot of times there is a gap between healthcare and mental health care. And, the healthcare professionals, they're doing so much, but they might not have the time to really focus on those other needs that are there. And so that's where the social worker really comes into play, being able to kind of see where those gaps are and fill them. And again, this can be by providing therapeutic support, collaborating with providers outside the hospital, and even inside or the whatever healthcare setting it may be, providing support to all family members, however that may look, and then just connecting the family's community resources. And as I said, bridging that gap between healthcare and social work. And these are my references. Thank you.